are at the very south end of the building. Our main entrance is located at the north end, so we are now down at the south end of the building. So our south entrance here for our staff entrance. And down here we also have our inpatient pharmacy. So inpatient pharmacy is located over here. We won't actually go in, but we wanted to kind of show where it was located. And we'll show you our dining room and kitchen area. So we'll move on in here, and we have, of course, all of our seating all out in this area here. So pretty nice setup. And in here we have our kitchen, and we're currently creating some good food in here. All right, so we're moving from our dining room into our kitchen area here. So this is our brand new kitchen, and we've got some burgers going over here. Actually, some of our first meals to be cooked in the new facility. This will be our tray line over here. All right, so we have left our kitchen and dining room area, and we're gonna make our way down towards surgery. On our way, we've got an environmental services room here, so that's what EVS stands for. We've got one of our clean linen storage areas, and then we're getting down to our dressing room area for surgery. So you'd come in, get in your sterile garb, and then you come out inside of the OR corridor. We will move into our surgery area here. All right, so this would be the door that you would come out of into the OR corridor in your sterile gown. So moving on down, we've got our OR here. So this is the operating room here. This is basically a state-of-the-art OR here with our exam lights here. So these are the large surgical lights here. And then we've got our monitors for viewing our procedures as those are going on. All right, so we will move out of our operating room and back down our OR corridor. We've got our anesthesia workroom over here. So that's where the anesthesia work will be done. All right, so we've left our OR into our PACU area. So PACU is our pre and post-op recovery for surgery. This will be our control station for nursing staff in this unit. And out here is our recovery area. So we've got 2 beds for recovery and 2 for PACU here. So it's a 4-bed bay. And this would be used for overflow. If we were to fill up our 8 inpatient beds, we would utilize this area here. So moving on down, here we've got our procedure room. As you can see, we are kind of in our planning phase, so that is why you will see these sticky notes. That's for supply stock phase. And in here is where we will do our dirty procedures, such as colonoscopies. So we can separate our clean procedures from our dirty procedures. This is a room that we do not have at our current facility, so this is a new space. So surgery staff are excited about that. Okay, so we're nearing the end of our PACU surgical unit. We'll move out of this unit into our main corridor, and we're gonna make our way towards radiology. So make our way down here through this set of double doors here. We've got a couple of staff restrooms here, and we'll make our way to our radiology department. We are at kind of the central point of the building here. We'll pop in. We do have a donor sign for Mark and Jesse Milano. The Milanos did do some donations for our radiology department. Our radiology manager will be over here. And we've got some dressing rooms over here so that our patients can get ready for their diagnostic imaging. Over here, we'll make our way to CT. So this is our CT scanner here. This is the Siemens Somatome Go Up, and this is a state-of-the-art CT scanner. It's a 32 slice that doubles over as a 64 slice. So That is the best you can get out there on the market currently. And this thing can hold up to 500 pounds. We'll make our way down our radiology corridor here, and you'll see that we have a staff restroom. We've got our ultrasound room. Okay, so our ultrasound is at our current facility, and that will be coming over with us when we transition. So we're gonna make our way down to our X-ray room. So you will see in here, this is our X-ray machine. So this is our Siemens Luminos Agile Max. And again, this is a very state-of-the-art machine here. This is the best you can get on the market. And it actually lowers all the way down to about 18 inches off the ground so that we can get our patients on the bed easier. And you will see that we have our mobile X-ray unit as well. So our portable X-ray unit, Mobilette Alara Max, so that we can mobilize our X-ray capabilities. All right, so we've just left our radiology department, and we're gonna make our way back up our main corridor, and we will end up in our main lobby. So our medical records department will be in this space here. And we're making our way towards administration, so we'll hop into administration here. So if you are looking for either Kevin Kramer, our Chief Executive Officer, or his administrative assistant, it will be located here. And this actually feeds back to our admitting booth. And right next door, we've got our Chief Nursing Officer, Ed Johnson. So this is kind of our administrative area here. All right, so moving away from admin, we'll make our way into our main lobby. So we are right back to our main lobby here, but we're gonna make our way into building 200. So this is our clinic building here. So through this doorway here, we've got the separation of the two buildings. So hospital building on this side, our clinic building on this side, and while it looks like one continuous building, it is two separate buildings that actually have shared footings that run north and south the length of the building. So the purpose for that is to allow for any seismic activity. So if there's any seismic activity, that will not compromise the infrastructure. All right, so we are in our main lobby for building 200, which is our clinic building. So we've got seating over here for our patients. And we do have some seating over here as well. And you might see our gift shop over here. So we will have a gift shop with some MODOK medical garb and cool things in there, and anything else that a patient or family of a patient might need. So our main registration desk for clinic here. So all patients will be registered up here. And over here is actually our retail pharmacy. So that will no longer be located on Main Street over by physical therapy. So this portion here would be our over-the-counter area. So we will have some shelving units here, about 3 of those for our over-the-counter products. And then back behind our glass will be the rest of the drugs that need to be prescribed. All right, so we will make our way from our clinic lobby into our actual clinic. So if you are a patient coming in to be seen here, we would come in this door. We will move back here. So we've got medical records here, and then our patient intake area would be over here. So we'll have our scales here. Those are at the current clinic, and we'll transition over with us as we transition. And we'll make our way out here to our MA care coordinator station. So in our clinic, we have a pod set up where a medical assistant works with a care coordinator under a provider. And so this is one of our 2 MA care coordinator stations. And we will show you the other one as well. It is catty corner to where this one is located. And the way our clinic is set up is around the outside of our clinic is our exam rooms and procedure rooms. And then on the inside of the clinic would be our provider offices and interior rooms. All right, so in our clinic, we do have 11 exam rooms and 2 procedure rooms. We will show you what those consist of. So we'll pop into an exam room here. Typical exam rooms. This is a computer workstation that will be set up, and we will have our exam chair that will come over from the current facility. So we've got 11 of these exam rooms, and they are all set up the same way with all the same provisions. There are 10 others, 11 total, and we'll show you a procedure room as well. All right, so we're leaving our exam room. We'll make our way past some other exam rooms. They are all exactly the same, but we will make our way around the perimeter of the clinic here. So more exam rooms over here, and then we've got provider offices on this side. So each provider office is right near their exam rooms, so each provider is set up in close proximity to their exam rooms where they will see their patients. So again, provider offices over here, and then we've got exam rooms on this side, and we'll actually move our way into one of our 2 procedure rooms. So the procedure rooms have the same provisions. The only difference is that it's a little bit larger so that we can get more staff in here to assist with the procedures. You'll notice that we do not have our exam chair, but that is coming over with us, and it is in the current facility. So we will make our way down our corridor here. All right, so we've got our equipment storage on this side here. Our immunization refrigerator will be located in there as well. Our soiled linen room will be located here. And then we make our way to our second MA care coordinator station. Kind of show you how this is set up here. It is oriented the same way as our first MA care coordinator station. And we are now at the very far west side of the building. So our second procedure room is located here. And again, all of our exam rooms will run along this side, and then our provider offices will be on this other side here. So we do have a connecting corridor here that actually connects the 2 MA care coordinator stations with a supply room here and a medication room as well. So moving on down, provider offices over on this side here. And again, our exam rooms over here. All right, so we're making our way to our final exam room here that will actually be utilized for telehealth as well. Thank you for joining us on our virtual tour today. We are doing this virtual tour in segments, so please be on the lookout for our next installment.